Hello and welcome to this very short little introduction to Essential Somatics Movement. My name's Samantha Holland. I'm an Essential Somatics Movement teacher and my passion is educating people about somatics so that they can get out of pain. So we're going to do a short exploration of the potential for this work and the core technique that we use in somatic education, any somatic education in the tradition of Thomas Hammer. So I'll teach you that, and I'll teach you that focusing on our shoulders, which is often how I teach it, and it's a really useful way to understand this fundamental technique of pandiculation. We'll do a little bit of work with our neck. I wouldn't want to do 15 minutes of work on the neck because it's so important to get the whole body moving to address neck pain and tension, which was one of my major discoveries when I found this work when I was in a lot of pain. But we will do a little bit of movement to get some neck pain alleviation, or at least give you a sense of how that can happen through pandiculation and through gentle movement. So make sure you're sitting comfortably on a chair. Ideally, you should be sitting towards the edge of your chair so that if the center of your body moves with this movement, then you have somewhere to go. So you're not like sat back, wedged into a chair. But really the most important thing is to be comfortable. So be comfortable. Get my hair out of the way. And I'm going to ask you to take the fingers of one hand and put them on the opposite shoulder. And if for some reason it's really not comfortable to have your fingertips on your shoulder, don't worry. Your fingers are only there for feedback. So you're not pressing your shoulder into them. You're not pressing your fingers into your shoulder. They're just there to give you a little bit more information. So, can you, and it may be a small movement for you, medium movement, or a big movement. I try to make larger movements on screen so that you can see what to do. But can you just then contract your shoulder up towards your ear as far as is comfortable? You can go into a little bit of discomfort, but there's no real need to. It's really just as far as you can go. And then you can see under your fingers, you can feel the contraction. Names of the muscles don't matter. What matters is that whole area. Just contract whatever you need to lift your shoulder. And then just slowly, gently, with awareness of what's happening, let that go. And let your body move with it if it wants to. You don't want to be holding your neck, your belly, or anywhere hostage. You want to keep moving. So, lastly, just let it rest. Just let that shoulder stop where it wants to, so you're not pushing it further, and just give it a moment to rest. While we're here, can you just check in on your breathing? So maybe put one hand on your belly or both hands. Notice if you are breathing into your belly so that you're getting the most oxygen that you can. Not breathing into your chest. Notice putting your hand on your belly encourages you to breathe a little bit more into your center rather than up here. Take that moment and then take the same hand, put the fingertips back on that shoulder, and we're just going to do that again. This is pandiculation. Pandiculation is a three-part process. Part one is bring your attention to the area that you're focusing on and contract the muscles. And that brings the attention of your brain and nervous system to it. So if you have a tight shoulder you want to work on, contract it. And then slowly, this is the longest part of pandiculation, part two, release. Paying attention to what's happening. If you close your eyes especially, you can really sense what's happening from the inside, or try to sense. Are there any jumps or jerks or shakes? Can you control the movement the whole way down, or are there parts of the movement where you're less in control? The third part of any pandiculation is just allowing rest. This is really crucial because it's only if you allow that moment for rest that your brain and nervous system can actually integrate the information that you've given them by doing the contraction and slow release. So if you leave out the third part, You won't do yourself any harm, but you'll just be doing movement or exercises. So you won't get the full kind of long-term benefits that pandiculation can create because it affects your nervous system. We'll just do one more of those. So contract up, slow release. If you feel jumps or shakes, or like you're speeding up or it's difficult, that's because you're not used to, your nervous system is not used to being in control of that part of the movement. And we work with that in somatic education, in essential somatics movement classes. Just take a breath in between, press pause at any time for joy of video, and just take the opposite hand, put those fingers on the opposite shoulder, and we'll do 3 on this side. So pandiculate by contracting to bring your nervous system's attention to what you're doing. Don't stay rigid and rest of your body, you can move. Part 2, slow, gentle, conscious release. Pay attention to what's happening. Notice what you're doing consciously and what's happening unconsciously or automatically. And have that third part, the rest in the pandiculation. Breathe. Keep breathing the whole way through. Sometimes we forget to breathe in any kind of exercise. Don't. Contract that shoulder up so that you can create a slow, conscious, voluntary releasing movement, decontracting some or all of those muscles. Let it rest where it wants to, don't push it. The idea is, and what usually happens is, that you end up a little bit more relaxed, a little bit more released after a pandiculation. Do that a third time, lift this up. Slow, conscious movement. And let that down. And just breathe. Try and breathe into your belly and see if your back arches gently. When you breathe out, let your back release. It might even curve out a bit as your front compresses. Just see if you can exaggerate your breath and allow yourself to move without pushing. You're not pushing yourself. You're just allowing your breath to move your body. And see if that makes sense to you. Because the more movement you can get in your breath, the more movement you tend to be able to get throughout your body, throughout your somatic systems. Okay. So we're going to do a little bit more with the shoulders, but before that, I just want you to look gently and slowly and no further than is comfortable, first in one direction, then the other. So just look one way, notice how far you can go, notice how it feels and where you might feel tension. Release that, come back to center. And then again with your eyes open, look in the opposite direction. Can you look as far? Do you feel tension in the same areas on the other side? Just notice that. Then can you just do that once or twice each side, but this time with your eyes shut. And you might want to feel your neck on the opposite side from the way you're looking. So I'm actually looking to my right. I have my fingers on the left of my neck just to feel those muscles really contract. And then also feel them release. So those are some of the muscles pandiculated there. And do that on the other side with your eyes shut. Keep breathing. And when you're ready, don't rush. Come to rest, and you can press pause if you need to. So again, I would ask you, if you can, It's not comfortable for everyone, but if you can you sit towards the edge of your chair and make sure your feet are in contact with the ground, so you might need a book or a yoga block or something underneath them. And just going to do some gentle shoulder movements, and as with all these movements, these can be as big or as small as you need them to be. So pick a shoulder. I'm going to use the one closest to the camera, and can you just take that shoulder up, contracting it, slowly release that contraction. Just let it go as far as it wants to. Don't try and push it further. Rest for a breath. And then can you think about your armpit under there, and can you take that shoulder down towards your hip? And notice your hip may well come up off your chair a little, and that's fine. Movement is good. And slowly ease your shoulder back up. Lengthen again between your armpit and your hip. And just notice how that felt. And then you might want to put your opposite fingertips on the front of your shoulder for this. And you just keep breathing. So breathe in. On a breath out, just take your shoulder as far forward as is comfortable and let your head turn in the opposite direction. Notice the contraction in front of your shoulder, the lengthening of your back. Don't overdo it. You don't gain anything by stretching or pushing. Gently ease your shoulder back to rest. Let it rest for a moment. And just repeat that. Just let your head and neck move, so they'll go probably face away from that shoulder a little. Ease your shoulder back. Notice what else is moving in your body. Are your hips? Is your center twisting? Are you trying to just move the shoulder? Let everything else move. Breathe. You can keep your fingers there if it helps. This time, you're going to breathe in and take your shoulder back. Your head, your eyes are likely to go in the same direction. So can you feel your shoulder blade going back and towards your spine? Is that something you're aware of? Let it rest. And I'm going to show this as a tiny movement. You can do what size you like, or do another one. You might only go that far. If you can feel something, that's what matters. Come back to rest. Let everything rest. Just take a moment, actually, and notice if there is any difference from side to side at this point. Then focus on the opposite shoulder. So for me, it's the one furthest away from the camera now. Contract that shoulder up. Let the rest of your body move if it wants to. Ease that shoulder down. Second part of your pandiculation. Let it rest where and when it's ready to. Third part of the pandiculation. Put your focus in that kind of armpit area. Gently contract your shoulder down. So your side might get shorter, or your hip may well come up. Other side may lengthen. Ease gently out of that. And it's okay if it's a tiny movement in you. You might want to put your opposite fingertips on front of your shoulder. Breathe in to prepare. Breathe into your belly. Breathe out and let that shoulder come forward as far as it wants to. Notice the contraction across the front. Notice the lengthening. Do you feel your shoulder blade move away from your spine and your back? Even if it's a little bit, ease that back. Take control. Notice if it's jumpy or shaky or hard to control, or if it's fairly easy. Let it rest for a moment. Breathe in. Breathe out. Let your shoulder go forward. Keep breathing as you need to. Let your head and neck move away, and slowly ease that back. Notice if this side feels different. Is it harder to control or move or easier than the other side, or does it feel similar? Take a breath in, take that shoulder back, your arm may go back, your head will likely look the same way, shoulder blade will probably go towards your spine. It can be a big movement or a small movement. Ease out of it, gently, slowly, with awareness. Come back and just do that once more. So you're taking a breath in, taking that shoulder back, keep breathing as you need to. Notice if the weight goes more into the buttock on the side that you're taking back. Notice any other differences, like different weight into your feet as you ease back out of that. In your own time, come to rest. And now, can you take your right shoulder forward and your left hip very slightly back? That's wrong. You do that. Okay, so now can you focus on your left shoulder and your right hip? Can you take your left shoulder forward and then let your right hip come slightly forward, just slightly, and then ease both of those back. Notice if this is easy or difficult for you to choreograph in your own body. It doesn't matter, just observe it, okay? Left shoulder, right hip. Left shoulder goes forward a little, right hip comes forward a tiny bit. It will be a smaller movement in your hip. So it's like the front is getting shorter between those 2 points. And then ease out of that. Do that once more. Left shoulder, right hip, go forwards at the same time. Ease out of that. Notice where you felt any lengthening or any change. If you felt any strain, make the movement smaller. Other side, put your fingertips on your left hip and your right shoulder. Take your right shoulder forward and then let your left hip come forward a little. Ease gently and slowly out of that, however big or small the movement is for you. Repeat that. Right shoulder, left hip. Notice if you feel the length in your back or the contraction in your front more clearly. Breathe. Do that one last time. And release. Pause if you need to. Notice how you feel. When you're ready, can you roll both shoulders forward and inward? Look up a little bit. Your knees might also want to come together. And then slowly release out of that by lengthening your front and allowing your shoulders to open up a little. And then can you roll both shoulders back so it feels like your shoulders are going towards each other across your back. Your back may well arch. You may tip a little off the chair and then ease out of that. And remember, you can make it a much smaller movement than I'm doing. It's what it feels like to you that matters. And then can you gently just shrug both shoulders up? Look up very slightly. Look very gently to the right, tiny bit. Come back to center. Look very gently to the left. Come back to center. Keep breathing and slowly let both shoulders ease down. Notice if one is faster than the other, one is easier to control than the other, one is smoother than the other. And just breathe. You can place one hand on your belly if you want to. Notice your breath. Take a moment. And so just see how you do feel at the end of this. Notice how you feel from the inside, but also do just a couple of tiny checks. So just pandiculate one shoulder once more. So contract it up, gently, slowly, taking as much time as you need. Let it release down. Don't push it, just let it rest. And then take that hand, put it on the other shoulder, pandiculate that shoulder. Contract, slow, gentle release with awareness of your own movement, preferably with your eyes closed. Let everything go. And then very gently, a couple of times to each side, just look. You can choose whether to do this with your eyes open or closed, or whether to vary it. Come back to the front. Breathe in and bring your chin down a little towards your chest. Let that go. Keep breathing and relax in the middle. Take a breath in. Breathe out. Let your front sink and look up a little. Slouch. And then breathe your way out of that slouch. It's a pretty short intro, but I'm hoping that you learnt a little bit about how somatics works, what it can do for your shoulders and potentially for your neck. And I really hope that you felt at least a little bit of release as well, a little bit of pain relief. And I also hope that you will want to investigate and explore this work further.